Welcome to the video, Level 4 Case Examples, Maternal. In this video, we'll review 4 complex breastfeeding situations that might occur with WIC mothers. Before we begin, please pull out your handout, Assessment Case Examples, Maternal for Level 4. We're going to ask you to pause the video while you work on this handout. Read the description for each of these 4 situations. This helps set the stage for the problem you will be assessing. You'll then want to use your critical thinking skills to answer the multiple choice questions that follow each scenario. Once you have completed all 4 of these scenarios, you can resume the video. At that point, we'll walk through the rationale for the correct responses. You can then check your answers as you listen to the video. Be sure to discuss your responses with your supervisor or your training preceptor. The first case is Gabriella and her 6-day-old baby, Isabel. Gabriella is not sure she makes enough milk and her mother suggested she give formula. She nursed Isabel around 11 to 12 times every 24 hours in the early days. But lately, Isabel becomes so sleepy during the feedings that she stops nursing soon after she starts. Gabriella thinks her baby is tired from the long labor. Her baby lost 9% of her birth weight, and she still is not beginning to gain weight back. What 2 things should you address first? The correct answer is C, baby's weight loss, as well as E, mom's milk production capacity. At 6 days of age, Isabella should be starting to regain weight. Her sleepiness indicates she's not getting enough calories and she lacks the energy to be able to wake up and feed. This can be a very scary thing for any new mother. The first thing you want to do is to affirm her feelings. The best option for this is C. It sounds as though you care about your baby. Gabriella might be questioning her ability to be a good mother since her baby's not gaining weight. When you reassure her, you'll help her relax so she can hear your information. The next step you should take is C. Ask probing questions. We do not know enough at this point to be able to give her information. Of these questions, the best probing questions you can ask are options A and C. If Gabriella is sore, that could indicate poor positioning and latch. So asking how breastfeeding feels is a really important first question. It's also important to ask her to describe a feeding session. You can learn when the baby becomes sleepy and whether the baby feeds off of 1 or 2 breasts. We don't need to know the brand of formula because she's not told us yet whether she's following her mother's advice. Options D and E might be part of a deeper assessment that you might need to explore after you examine these basic issues first. The 2 most important areas to assess at this point would be options B and D. Observing a feeding session helps you rule out positioning and latch issues. You can also see how the baby behaves and how the mother responds. While the mom and baby are feeding, perhaps you can observe her breast. Do you see any maternal issues that might cause the baby's low weight? You might also explore other options at some point, but they may not be the first things that you need to examine. As you'll recall from working on your worksheet, you learned many things from this initial assessment. First of all, mom has no issues with sore nipples. She never felt engorged. Her breasts feel the same before and after feedings. Although she has not yet started formula, she thinks it might be time. Her baby only had 1 bowel movement yesterday, and it was a dark brown color. The baby only has scant stools. When you observe her breast, you see a jagged scar around her areola. A second clearer scar appears on her other breast. She confirms she had breast surgery 3 years ago and a second surgery later. Her surgeon told her she would be able to breastfeed, but since then she has not felt any nerve sensation in her breasts. The most obvious cause of her issues is C, her breast reduction surgery. The visible scarring is a clue that her milk production may be compromised, especially since she does not have any nerve sensation. Although her surgeon told her she could breastfeed, the surgeon might have meant that she would still be able to latch her baby. Milk production might be affected. The other options listed can also contribute to low production, but in this case we might consider them secondary issues. This mom is going to need a comprehensive plan to help her continue breastfeeding. Option C is the best choice for this. We need to help Gabriella maximize her production by using a breast pump to drain her breasts. Frequent feedings and breast compressions can deliver a little more milk to the baby. But realistically, she might not achieve full milk production. We could offer her a nursing supplementer since she wants to be close to her baby. Since her baby has signs of poor intake, she might need some formula supplements along with whatever milk that she's able to express. 4 ounces is too much for a 6-day-old baby as listed in options A and B. Also, a nipple shield may not be needed because the baby is able to latch. The care plan should also include close monitoring of the baby's weight and diaper output. We can also give instructions for using a nursing supplementer and a breast pump. We can give her some tips for waking a sleepy baby. We're probably going to need to check in with Gabriella and her baby in 1 or 2 days to see how the plan is working and to be sure the baby is starting to gain weight again. We'll also want to refer to the baby's healthcare provider. The peer counselor, of course, can offer the mother some ongoing support. The second case example is about Maggie and her 4-month-old son, David. Just as a reminder, Maggie had sore nipples in the early days, but they resolved. She's been back at work exclusively breastfeeding for the last 2 months. Today she phoned WIC to report that she felt she had the flu. She wonders if it's okay to breastfeed when you are sick. She regrets now that she never got a flu shot. The clerk referred Maggie to the CPA, and she suggests that the DBE assess her. The 2 most important issues to address are A, Maggie's symptoms of illness, and D, the challenges that this may pose to breastfeeding. Her symptoms could relate to mastitis, so we want to learn more about this. Option B may be something to explore later, but it might not be the most important issue right now. Baby's output is not that helpful because of the baby's age. Maggie needs to be affirmed before we go any further. The best response is A. You seem really tired and overwhelmed. Options B and C are not affirmation. They are education. After you affirm Maggie, you'll want to learn more about her symptoms. Option C is the correct response. Flu-like symptoms potentially can indicate mastitis, so we'll want to learn more while referring her to her healthcare provider. The other options are premature until we have learned more. What probing question will be best to ask next? The correct response is option B. Tell me more about how your breasts feel right now. We already know she feels she has the flu. Now we need to know more about her breasts so we can rule out mastitis. The other options may not be most important to ask first, since getting the mother help for her illness is the priority. So what areas of assessment will be most helpful? The correct response is option C, her breastfeeding history. This helps you learn when her symptoms began, any patterns of missed feedings, and the challenges that she has experienced. As a result of your assessment, you learn some important things. As a reminder, this is actually the 3rd time that Maggie has experienced mastitis symptoms. She reports her breasts are very pink and hot to the touch. The reason she thinks she has the flu is because her fever is higher than it was before. You also learned that she had cracked bleeding nipples in the early days, and they cleared up on their own without treatment. And she tells you she had breast augmentation surgery and often develops plugged ducts. She says her life is very hectic since she went back to work. She's not always able to express milk regularly, and she feels stressed. Her partner gives the baby formula at night. What do you suspect is the problem? The correct answer is option A, recurrent mastitis. It's possible that bacteria entered her breast through her early cracked nipple, which have remained dormant in her body. However, her healthcare provider will be the one to make a definitive diagnosis of mastitis versus the flu and prescribe treatment. At this point, we don't necessarily suspect a breast abscess based on what the mother describes. Plugged ducts can occur from pressure of a breast implant, especially if the breasts do not stay well drained. But her symptoms seem to indicate an infection that requires medical care. The most important aspect of the care plan is option A. Refer Maggie to her provider for diagnosis and treatment. Regardless of whether she has mastitis or the flu, the healthcare provider should be consulted. The other options might be good education, but the mother first needs medical care. Beyond this important referral, there are some tips and solutions that you can include in her care plan to help her continue to breastfeed while she's being treated. Your plan might include tips for keeping her breasts well drained. You could also share information on why mastitis can occur. You can also let the mother know it is safe to breastfeed when she is sick or has an infection. You can include follow-up as part of the plan and referrals to her provider. You can also connect the mother to a peer counselor for support. The next case involves Karen and her 3-week-old baby, Jeffrey. Karen tells the CPA that breastfeeding is going great and Jeffrey has gained weight well, but she finds breastfeeding excruciatingly painful. Her nipples are not cracked or bleeding, but she still feels intense, sharp, shooting pain through her breasts. The CPA rules out latch issues since Karen is pretty sure Jeffrey latched well and refers the mom to the DBE. When you worked this scenario, what did you decide were the 2 most important issues to address? The correct answer should be C, nipple pain, and D, position and latch. Karen's main concern is pain, so that is the most important issue to explore. Even though the mother says she thinks Jeffrey is latched, it might still be good to rule that out. The other options may be good to explore later, but probably not the first thing to address. The best way to respond to the mother is to affirm her. Option A is best. You must love your baby a lot to continue breastfeeding even when it hurts. Option B is education, not affirmation. Option C is a question. It's not affirmation either. Even though we might want to ask her for her ideas, it might be a little premature at this point. The next step is to learn more. Option B is correct. It's too early to conduct a detailed assessment or to offer tips until we know a little more first. What questions can help you do that? The correct answer is options A and C. Because the mother's priority is pain, we need to learn more about it. What is it like? When did it begin? How long does it last? It's not likely that soap would cause pain, and we are not concerned at this point about the baby's behaviors because the baby is gaining weight well. The most important areas to assess next will be options C and D. A breast assessment could help you identify any cracks or sore areas that are causing her pain. A feeding session can help you observe how the baby latches and any comfort measures that might help. At this point, an infant assessment may not be necessary since the baby is transferring milk well enough to gain weight. You can always assess that later if other causes have been ruled out. Mom's support is also something that can be included as part of your final care plan tips. You learned much from this assessment. So just as a reminder, the mom tells you she has experienced the same pain with her other children. She describes sharp shooting pain that radiates through her nipples and breasts. She's been treated for nipple thrush multiple times, but the pain remains. She even went through antibiotics to rule out an inner bacterial infection. It hasn't helped either. The mother has no signs of cracked or bleeding nipples when you conduct your breast assessment. During the feeding assessment, the baby's well positioned and latched. Baby has normal suck-swallow-breathe patterns and you can hear swallowing. When the baby falls off the breast, the nipple shape is normal. However, you observe that her nipple is blanched white and slowly turns blue. This is when the mother grimaces in pain. She assumed this is what nipples are supposed to look like. She also tells you her fingers often turn blue when she's cold. Now you have enough information to identify a possible cause of her pain. The correct answer is B, vasospasm. While the other options can certainly cause pain, this mother's most likely cause is vasospasm. This is linked to Raynaud's syndrome. With this condition, the mother's nipples can turn white after feeding. When the blood returns to the site, the nipple can turn other colors and the pain can be excruciating. As part of the care plan, you're going to want to refer the mother to her healthcare provider to diagnose and treat the condition. In addition to that, option A gives you the best items to include in this plan. Since cold can trigger vasospasm, she might want to apply warmth to the breast to help alleviate pain. Mom should continue to breastfeed. She can consider avoiding vasoconstrictive agents like caffeine and nicotine because these have been found to increase those symptoms. Cold compresses can actually trigger vasospasms, so she should avoid those. Eating fruits and vegetables are good for your overall diet, but they're not going to affect vasospasm. Your care plan can also include tips for working these recommendations into her daily life. You'll also want to provide some follow-up with the mother. You want to include a referral to the mother's healthcare provider and connect her to her peer counselor for support. The final case example in this video is Keiko and her 1-week-old baby girl, Mickey. Just as a reminder, the baby weighed 5 pounds 8 ounces at birth, and at 1 week, she's 5 pounds 4 ounces. Despite exclusive breastfeeding, Mickey only has 1 or 2 stools and 2 to 3 wet diapers every 24 hours. Keiko wants to breastfeed, but she's worried that she's not making enough. Her mother from Japan, who is staying with her, encouraged her to use formula since it is the choice for American women. The peer counselor noticed that the baby was very fussy at the breast and did not seem satisfied. She asked the DBE to assess further. So what is most important to address? The correct response is A, milk transfer, and D, the baby's behaviors before and after feedings. Because the baby has poor output, we should be concerned about milk transfer. We also want to know more about these babies' behaviors. The grandmother's presence might influence Keiko's decisions. However, it might be premature to assess for support until we know a little more. Her goal may change if she's worried about her baby. It's much more important to assess milk transfer. But before we assess, we need to affirm Keiko. This is especially important if she's getting negative advice from her mother. When the grandmother is present, we should always make efforts to affirm her too. Both will be more likely to hear information when they have been validated. So the best response is B. Baby Mickey is so lucky to have so many people who love her and look out for her. Option A is education. It could also plant seeds of doubt. Option C is an affirmation, but it's weak and it doesn't really tune in well to what this mother might be feeling. After you affirm Keiko, what should you do next? The correct response is C, learn more. Many things could be causing the baby's behaviors, so probing more will help you narrow down the areas to explore further. Educating the grandmother is a bit premature right now. Asking for privacy could be taken as disrespectful. It is also premature to talk about breast pump options at this point. We can start that narrowing down process by asking option A and D. These questions help you learn more about feeding patterns that might affect the baby's weight. It's premature to ask about formula since the mother has not yet reported using it. Her reasons to breastfeed are also not as important as learning more about her concerns. The two most important areas to further assess are options C and D. Observing a feeding and assessing her breasts could help you rule out factors that can cause slow weight gain. This could include things like inappropriate latch, prior breast surgery, and other factors. The other options might be useful to assess at some point. They may not be the most important thing we need to know first. So what do you learn? Well, mom reports the feedings last an hour or more and baby wants to be fed about every hour or two. Even after the long feedings, the baby fusses and wants to suck more. Mom does not have sore nipples. She says feedings are comfortable. She's not engorged. And baby's positioned and latched well. You do observe a wide space between the mother's breasts. When you probe this a little more, Keiko says she never noticed any changes in her breasts during her pregnancy. She's not aware of any medical conditions. Now that you know more, what is the likely cause of Keiko's worries? Option C, insufficient glandular tissue, is the correct response. A wide space between her breasts and a history of no breast changes are your main clues. There's no indication that the baby has an oral anomaly or that the mother has experienced birth interventions that delayed her production. Poor dietary habits do not cause insufficient weight gain, except in extreme cases of malnutrition. What did you select for the best plan of care? Well, the correct response is option A. In addition to frequent breastfeeding, Keiko can try pumping after feedings. The milk she expresses can be given at the breast with a nursing supplementer. This can also be used if formula supplements are also needed. Mickey also needs to be closely monitored. The other options might be considered later depending on how things go. As part of the care plan, you can give information on signs of appropriate milk intake. You can also help Keiko know how to monitor the baby's diaper output. Weight checks every few days can help assure the baby's doing well. You might also include in your care plan follow-up and a referral to the baby's healthcare provider. You can also connect the mother to her peer counselor for support. This ends the Level 4 video, Level 4 Case Examples Maternal in the Care Plans and Case Studies video series. Please take a few moments to pull out your WIC Action Journal and turn to the Breastfeeding Assessment page. Write down something you did not know before viewing this video or something you want to be sure and remember. Set at least one goal of something you will do with what you have learned. Please complete the Level 4 post-test for this video. You can turn that into your supervisor along with any handouts for this video series.